She can hear me. And it is 9:02. I'm not supposed to start late. I'm sorry for the technical difficulties. Hi, I'm Lee Sheldon. I guess you know that already. Listen, I told you I want to show you that I want you to differentiate yourself. This is the first time I think that I've worn pink. What do you think? This is what we do. You see the solid, this camera thing. You see we got the Solid Bite logo. And yeah, I'm the only one who wears pink in Brevard County, Florida. And I've been known for pink. And I know it takes a real man to wear pink. At least that's what we say. Anyway, differentiation is important. You know, we are differentiating ourselves. This is part of what we're doing with the AAIP is we are showing how to differentiate ourselves, not as periodontists. You know, most of the patients, or at least half the patients that come in, don't really care that I'm a periodontist or not. They really don't. They want to know that I'm going to be able to take care of their problems. And they're looking at me as a dental expert, and that's what we want to concentrate on at the AAIP. We want all of us to differentiate ourselves as dental experts. Some of you have read AAP Connect. I know we all get it, and some of us probably read it, and some of us don't. And got a good response to the one I put in last week. It was an essay, and some of you made some nice comments, and I really appreciate that. And yeah, the responses that I got from people who aren't members of the AAIP were even more interesting. All of them positive. All of them understanding that, yeah, we are if we're not in crisis mode, we're certainly approaching a crisis. And that, in fact, there is a way to differentiate ourselves. Paul Rhodes, who many of you know, has been involved in practice management for a long, long time, wrote a beautiful, beautiful column in response to mine, talking really about the fact that we have to take this a step further, that not only do we differentiate ourselves as experts, and not only do we want to see the patients first so that we can assure that the quality of care is going to be what it needs to be, Paul took it a step further, and Paul said we really ought to be running our own group practices, you know, with the periodontist in charge of doing the diagnosis, having general dentists as well as specialists all working under one roof. And frankly, he's right. How practical that is for us really has to do with how big an oyster we can, we can fathom. But certainly with the way things are going, whereas corporate dentistry is coming in, there are going to be different levels of group practices, and why not have a periodontist run the highest level group practice and allow all of us to be able to know and to be able to assure people that in fact we are providing the best care. I made a reference also to Clear Choice. Now I don't have anything against Clear Choice myself. I actually have never met anybody who works in the Clear Choice practice, and of course you know Clear Choice hires oral surgeons and prosthodontists to work their cases. But I do know what dental implant centers do because I've had experience with 2 of them. And we need to understand that the dental implant centers primarily concentrate. Not primarily concentrate, they do. It's we can extract the teeth, put the implants in, and put the fixed prosthesis in. And that's what we do. And we can give you that service at whatever fee that is, and we can assure you that that's going to be done well. And I'm sure it is. And we do that too. I probably do 4 full arches a month, maybe more than 4 full arches a month. But that's not the only choice. And so when we're talking about the name Clear Choice, let's understand that we are the clear choice because we can do the full arch case, and we can also decide which teeth can be kept and which teeth can be kept predictably. And that's the key. It's predictability. We want to make sure that things can be done predictably and the patients aren't having a repeat of a problem. Now I'll take the typical example. I'm on my soapbox a little bit, and I understand. But you need to know where I'm coming from. You really do. And that is that we are looking at a tooth that has had endo, and then crown lengthening, and then the crown, and then we see it break off, and then we take that tooth out, and then we put an implant in. Where if the patient has seen, sorry about that, for knocking you in the head with a microphone. Whereas if the patient has seen us first, we should have been able to predictably diagnose the case first. And if a lot of tooth structure is gone, fine. Confront the issue now. Take the tooth out, put the implant into a bridge, or whatever is going to be predictable, and let's reduce the number of redos that are done. That's what's killing dentistry. And that's what's keeping patients away from dental offices. You know, I made the issue in the essay, I made the issue with you, particularly in the introductory webinar, that in 2004 when I started advertising, and I started advertising for dental implants, here's what the ad said. It was a newspaper ad about this big, small newspaper ad, and it says something like, frustrated with your teeth, or frustrated with your dentures, or frustrated with something. And I tested little intros. And essentially what I did was offer a free booklet on what dental implants could do for you, and people would call for the free booklet, and we send out the free booklet, and then we would follow them up. Or the patients would just call, and they'd call for an appointment. And of course, I was looking for denture stabilization. That's what we want to do. We want to stabilize dentures, get more implant patients in. Fine, we get implant patients in. We can do the implants. We can send them out to the restorative dentist. Restorative dentist can put the locators in or the bar in or whatever is going to occur. Here's what happens when you externally market. You don't know who's going to come in. You know, people are going to come in need, but you really don't know who's going to come in. And the type of patient that did come in was the patient who'd given up on dentistry. Oh yeah, we had some patients come in for dental stabilization. Don't get me wrong, they did. But more than half the patients when we did those initial ads, and even today, more than half of the people that came in are people who were frustrated with dentistry, gave up, and didn't know where to go. And because of a little stupid ad in a newspaper, people somehow decided to come to me. Now, yeah, I mean, there are certain things that I've done PR-wise so that my name is out there, but many of these people didn't know that. They were just frustrated, and they keyed in the word frustrated. And so we had a lot of patients who'd given up on dentistry. You know, they'd had procedures done, but the procedures weren't predictable. The procedures, any of us would have looked at those procedures, and I'm not criticizing the quality of the dentist, but we know that periodontists think biologically, and they think in terms of futures. That's how we think. What teeth are going to be around, what teeth aren't going to be around. That's what we did in our treatment planning conferences in schools so many years ago. And so we think in futures, we know what's going to be predictable, and therefore we would choose to extract a tooth that someone else, not trained the way we are, may have done a procedure on to try to save the tooth, only to find that tooth fail. Really, that's what we're marketing. It's really what we're marketing. That's what we're marketing, predictability. In fact, I put predictability in that essay last week a few times, because that's where we are. So when I said we are the doctors of complex dentistry, that's what it is. No, we're not going to do the crown and bridge. You know, you may not be a full service practice like mine finally became after 11 years. That's not what we're talking about. Actually, it became a full service practice probably after 8 years or 9 years. But we are talking about patients seeking us first, because then we can do the diagnosis, we can do the treatment plan, we can determine what teeth are going to be kept, what teeth aren't, and then we can refer them to the restorative dentist who's really going to do a bang-up job and make sure that everything's done predictably. That's what we're going for, okay? That's really what we're going for, and the reason I'm recommending it to you is because that's what I did, and it worked out well. Now, I've talked with a few of you, and really, I do love talking with you, because, you know, when you're talking to a microphone, essentially you're talking to a microphone, and you guys respond either with a phone call or with emails. It really helps. So please continue to send the emails. I want the feedback. I need the feedback, because I need to know whether what I'm saying is really resonating with what you want. But I've got a concern, so I'll share the concern with you. You know, and you can say, all right, well, this is the way I want to be, and this is the way you want to be, and that's okay. I'm only spouting off what I think is important. You know, a lot of you are coming to me with ideas which are great, but there are also concerns, and the concerns are external marketing. You want to be able to get that external marketing edge, and you do. And really, that's important. But I've got to tell you, I want to share with you the experience that I had with external marketing. Yes, I do a lot of external marketing, and I've done TV ads in the past, and frankly, what I would concentrate on is a good responsive website. Take a look at mine. I got 20 new patients in the month of June while I was on that nice vacation that I kind of told you about. We had a nice vacation to a Rhine River cruise to Germany, and then we took a cruise to Iceland. We had the kids with us, and it was really good. And we got 20 new patients off of the website. Now, it was the website combined with the Google AdWords campaign. And we have the same company, Gilliard Marketing, who's doing the entire thing, and they're really, really good, and I recommend them to you highly. You don't need to consult with me for that recommendation. Gilliard, G-I-L-L-E-A-R-D. Call them. They know what they're doing. But if you already have a website or you've already invested in a website, let me tell you what we did. We took the website that we had, which wasn't producing very well, and by the way, I was spending an awful lot of money for that website and had a lot of search engine optimization, and it still wasn't producing very well. And what I did was ask them to put different things into that website. And so I asked them to put in a way in which they could respond, whether a potential patient could respond. And so there was an Ask Dr. Sheldon box. I hired a chat provider, Ace Chat, and Ace Chat would be able to chat with a potential patient at least 12 hours a day. I think it's something from like 8 a.m. to 8 p.m., and no matter what time zone you're in, it's 8 a.m. to 8 p.m. That's how Ace Chat works. And they know something about dentistry, and they find out your profile, and they brought a few patients in. We had a recorded phone line. I put an offer in. I put a video in. There are different things that I put in order to be able to make a conventional website into something that would really sell. And then I hired a Google AdWords provider in order to be able to provide for somebody to be able to click on the ad, which would direct them to their website. And we were able to make that work. And I'll be happy to teach you how to do that. But don't get too much into external marketing now, and I'll tell you why. When I began my external marketing, I got these patients in, and patients were coming in, but not all the patients were being scheduled that called in. See, one of the most important people, if not the most important person, is the person who answers your phone. And unless that person is trained to answer the phone and trained every bit as well as any other staff member in your office, that phone person really doesn't know, unless they have an intuitive sense or unless they've been trained in sales in some other way, they really don't know how to schedule a patient. You know, we're used to getting patients who are referred from a general dentist. So the general dentist says, good, go to Dr. X, that's the best periodontist, go to him or go to her, and that patient will call and make an appointment. That's an easy appointment to make. But the patient who's calling you off an ad is a patient who is really, you know, he's kind of, oh, should I call this person? It's only an ad. It's not a committed patient. And therefore, the person who's answering the phone has to develop the relationship and has to develop a reason for that patient to make an appointment and to always move that patient forward in the direction of making an appointment. That's a totally different skill, totally different from what we do in a specialty office. And so when you hear Danielle talking on alternate weeks or alternate sessions from mine, and you hear me talking, we want you, and we're recommending that you develop your infrastructure first. And part of that is answering the phone. Part of that is developing your sales team, because you can spend all of this money on external marketing and have a lot of people calling in, and they will. You know, we have to test ads and see what ads are going to work, but once we have that, people are going to be calling in. And unless that person on the other end of the phone, meaning your end of the phone, really knows how to answer the phone and knows what questions to answer and how to transition a patient from that phone call to scheduling the appointment, because that's the purpose. If all you do is talk to your front desk staff tomorrow and say, what's your purpose? And they say, the answer to the phone, and you say, no, your purpose is to schedule the patient, I bet you're going to get more people scheduling. Not every question needs to be answered on the phone. The idea is that we want to create enough the level of expertise that your front desk staff is creating for you, then in fact that front desk person creates a little bit of mystery about you and mystery about himself or about the patient, him or herself, so that really by the time the patient is done with the phone call, the appointment is scheduled. And by the way, if the appointment isn't scheduled, then at least get the data for that patient. What's the patient's name, address, phone number, email address, because you want to be able to follow up and make sure they got the appointment they needed. Or they may not be ready to schedule now, and so you have their data because they called, particularly their email address, so you can stay in regular contact with them. You know, some people aren't ready to schedule right now. Well, that's fine. When they are ready to schedule, imagine if you're sending an email out to them once a week or once a month, you know, you're going to be at the top of their mind so that when they're ready to schedule, they say, oh yeah, Dr. X has been contacting me for a long, long time. Yeah, now I really need to do something about my teeth. Yeah, I'm going to call Dr. X first. So data collection is really important. And we're going to spend some time doing that. But in any sessions that we're doing with you, if we're talking with you or doing any consulting at all, certainly that's an area that we're going to recommend you focus in on first. It's your choice to whether we do that or not, but that's where we're going to be. Okay, a few other things. Yes, Danielle and I will be the AAP, and actually my hygienist, who's an expert using the periscope, Rebecca Caudill, who's been using the periscope nearly since Dental View came out years and years ago, and now it's Perioscopy Incorporated. She's an expert, and so if you want to talk with her about the use of the periscope, she'll be there. My wife will be there. Ellen will be there. We'll decide in some way that we can have a meet and greet, and perhaps, certainly if you want to, and you have some friends who you think ought to be members of the AIP, because the AIP is growing, and we have more members now, and it's continuing to grow. It's really, really a thrill. Then you know, we can meet together and we can talk about the AIP and see what we can do to address their needs as well as your needs. So if you're going out to San Francisco, I look forward to seeing you there. Okay, so I think that's all the things. Let me check my phone and see if there are any other things I want to talk to you about. Yeah, a couple talks we'll be giving North American Society of Periodontists. We're talking to their board on November 1st. Seattle Study Club, those of you members of the Seattle Study Club, I will be talking to the directors meeting on the final day of the meeting on Saturday. That's the closed meeting with the general dentists aren't there, and we'll talk. Michael Cohen was so gracious in inviting me. I was active in the Seattle Study Club for many years. I was a regional advisor for several years, and then I decided to go in my direction. It wasn't exactly a good fit, and so I decided to leave. Michael is running a program totally on business. Those of you members of the Seattle Study Club know that, and given the fact that we were taking a different course, Michael was so gracious, and as soon as he found out about the AIP, he called me right away or contacted me right away and asked me to speak. So we'll be speaking there. And anyway, let's move on. So let's talk about the doctor phone call. Let me get to this and get rid of some of this other stuff, and let's see if we can get the screen up the way it's supposed to be. There we go, the doctor phone call. Now, I'm doing this a little bit out of order, because what this is presuming is the patient has already made an appointment with you. Okay, we're going to talk about making appointments next week or next month. Danielle and I have a bang obsession about how to and how people answer the phone and how they should answer the phone. And a couple of you have already given permission for us to record your front desk people answering the phone. Now, I've got to tell you that we are going to play some of those recordings, the August session on how to answer the phone. But we are going to edit out your name, and we're going to edit out your staff member's name, so nobody can identify who you are unless you happen to recognize the voice, which the people in the AIP won't, because you're from all over the place. You don't know each other. You don't know each person's front desk skills, so it'll remain anonymous. But you'll see how a phone is answered, and then you'll hear how a phone can be answered. If some of you want me to do a secret shopper call with you, just let me know. Send me an email, and be happy to do that. So here's what's happened. The patient is called and has scheduled an appointment. Okay. And we talked about data collection. So there's Jasmine, and some of you already talked with Jasmine. The patient calls your office. What do? Number one, you collect the data, just like I talked about. Name, address, phone number, email address, whether the patient schedules or not. Okay, get all the data. The best list that you can have, we talk about marketing lists. The best list that you can have is the list of patients who are already in your practice. That's the best list to market to. Second best list is the people who are interested enough to call you. And the whole goal is to grow that list. We can send out external marketing to everybody, but if you already have people who called you, that's a prime list to market to, because they're already interested in you and have already considered you, or have already been patients of yours. So those are the people to market to first. But once we've done that, or as part of that, we want the front desk person to find out what's bothering you. What's bothering the patient? Is it a toothache? We told you had periodontal disease. If you're referred by a general dentist, are you missing teeth? Are you emotionally involved? Is it that you're going to get married in a year and you want to make sure your teeth look good? All of those things are things that are written down. Okay, important. And so when Jasmine does that, or Jennifer does that, they compile a list of new patients. And here's what you're seeing. So let's take a look at this first line. So we'll look at Ashley. Okay, so you see Ashley, and of course I've blocked out the last name, blocked out the phone number for obvious reasons. Okay, so the first date is the date that the patient called. The second date is the date that the patient is going to come in. The third is, what are they going to pay? Now, Ashley saw my ad, and so we know that patient is going to pay $79, and that $79 is going to include all the x-rays, including a CT scan, a full examination. And I know that kills some of you. Some of you are charging a lot of money for examinations. You know what? We deserve it. But you know what? Some people won't schedule because we're charging so much for an examination. We've arbitrarily picked $79. Okay, so the patient makes an appointment for $79, and 7/14/2014 is the day that I'm going to call that patient. So Jasmine will tell the patient, Dr. Sheldon likes to call all of his patients before they come in. He likes to talk to them on the phone to find out what's bothering them and how they're doing. And number one, the patients are flabbergasted. Remember, you're trying to differentiate yourself. How many doctors call the patient before the examination? Yeah, right. And so already you've differentiated yourself. There's another reason to call the patient. Sometimes the patient will tell you some things that may indicate to you that you might need to schedule a little bit more time for the examination. Let's assume it's a full mouth case and the patient's talked through it and says, my entire bite is wrong and I know I need a mouthful of, whatever it is, mouthful of implants, crown and bridge, whatever it is, and you need to spend a little bit of extra time with that patient, then you can note that, and so you can change the scheduling of that patient a little bit yourself. If you have a CT scan in your office and the patient said I need 1 or 2 implants, well, I might take only 1 PA rather than a full mouth series. Excuse me. And take the CT scan. And of course, it's all covered under the fee so that all of the x-rays can be ready for us, and I can instruct the assistant based on the phone call what really needs to be done at that first visit before I walk into the operatory. Fourth thing that it can do is help you screen the patient. Let's assume the patient said one thing to Jasmine, but when we talk to them, patient indicates that that unfortunately, for the services that we provide, they're not able to afford the services that we provide. Now, we're not gonna question them, but sometimes about that. But sometimes they just volunteer the information. They might say, "Do you take Medicaid?" or something like that. Well, then you can decide whether, in fact, you want to bring that patient in or whether that patient might be better off in a Medicaid office. So a lot of good things. But the basic thing is you're getting into communication with the patient, and the patient is impressed. And most of these phone calls take 2 minutes or less. Yeah, sometimes patients want to keep you on the phone for a long time. But most of these, but you can control that with communication skills. But most of these patients are just impressed just to talk to you, and it makes such a difference when a new patient walks in, particularly a new patient that's not referred from a general dentist's office, a patient who's actually come in as a result of an ad or a referral from another patient, or however that patient comes in, and you're calling that patient in advance. It is a killer. It's really, really great. So I recommend you try this. Now, what's nice is if you have this data, okay, patient called inquiring about Invisalign, and my son does Invisalign. She asked about financing, if she could have a co-applicant, her father. Patient is scheduled on 7/24 at 9:50. You can read it yourself. Okay. If I call the patient and say, "Hi, Ashley, good to talk with you. What are you here for?" Well, then Ashley says to herself, "Well, what did I waste my time talking to Jasmine for?" Now I got to tell the doctor the same thing. Or let's reverse it. If I call Ashley and say, "Hey, Ashley, I understand you need to get your teeth straightened. You're interested in Invisalign." Boy, is she impressed that the communication occurred. And not only did I just talk to her, but Jasmine thought she was important enough to give the information to me so that I was able to relate that information to her. And then we just get into a conversation. That's it. Just get into a conversation. And I'm going to simulate a conversation. I wanted to do one with all of you, but or with some of you, and I may take volunteers later on, but I'm not sure my sound is working well enough for us to be able to do that. Okay, here's another example. So now we've got Jean. Okay, now Jean called on July 3rd. She's scheduled with us on July 29th. She came in as a result of our charitable giving campaign. And some of these things we're going to cover more during our AAIP seminars later on this year. But the charitable giving campaign has worked wonders in our office. Patients call, and patients can come in to our office for $50 paid to a charity, and we have 8 charities on our list. They give us a check that's written to the charity, and they get all the exam and x-rays and everything else for nothing. Now, the only way that a patient can get in for the charitable giving campaign is if they're referred, either if they're referred by a patient or by a referring dentist. So those are the 2 entryways that a patient can come in. Yes, one, the $79 comes to me. The other is a charitable giving campaign. The $50 goes to charity. With a number of new patients that come in as a result of that, I've got to tell you that I could never go back to charging $200, $300, $400 or more for an examination. You know, by the time we get done with the examination and the FMX and $250 for CT scan, it becomes prohibitive for many people, particularly when people want to meet you and they want to hear what you have to say. We want to reduce the barriers as much as possible. I know that flies in the face of what you're thinking. Oh, I can't do that. You know, it's a lost leader, whatever you're saying. I've got to tell you that I used to charge what you charge. I'm doing better and getting more new patients in who are interested and are accepting at this $50, $79 fee. You can do what you want. You can, but you can also pilot things out. You can try things out for a month and see how they work for you. But we'll be going into more detail on some of these things later on. So essentially what we do, and you can see Jean called, and she wanted to make an appointment for a second opinion. She saw a general dentist. He recommended Bridges, but she doesn't feel that's correct and wants a professional's opinion. Notice a professional's opinion. And part of this is to build you up as a professional. You know, what can you do to gain exposure on the outside so that people see that you're a professional? Write a book, write a pamphlet, write an article. I mean, there's certain things you can do to elevate yourself. Okay, so she saw something that I wrote in order to get what the correct treatment is for her. And of course, some of this can be shown on the website. So if you do a lot of writing, and I would recommend that we do a lot of writing because the written word is still key. If you do a lot of writing, make sure you get it distributed wherever you can, and make sure it's on your website so that if you have an opinion on how implants should be done, if you have if you're into alternative health, if there's something that you think is really important with regard to crown and bridge, or with regard to perio, cosmetic perio, or whether teeth should be kept or not, or whatever it is, make sure you get that opinion out there. Because if you get that opinion out there on your website, on a blog, in an article, in your newspaper, in a pamphlet that you have in your office of all of your opinions, 500-word article takes an hour or two to do. And if that's out there, believe me, those articles impress the patient, and those articles will get distributed to other future patients. Amazing how the written word can just move from person to person to person, because you're going to be a little bit different from everybody else, because you write about the things that you do and about the things that are important in health. So anyway, the appointment was scheduled with Matthew, with my son, on July 29th when she returns from vacation. Okay, and so all of these notes are there, and then we make the appointment. So, or we make the call. So let me give you an example of how a call would be done. And wait, let me go back. Okay, so the call would be like this, and so I'm going to call Jean. Hi, Jean, it's Dr. Lee Sheldon. I understand that you want a second opinion, and that you saw your general dentist, but you're not really sure that you want to have bridges done. Is that right? And Jean would say, yeah, that is right. I'm a little bit concerned. The doctor told me that that I needed bridges. And, I had bridges before, and those bridges failed, and I'm just concerned about those bridges failing. And your answer would be, yeah, I understand that. I'd be concerned too. And one of the things that we pride ourselves on is that we look at the future. We want to make sure that what we do is going to last for a long, long period of time. So we're going to be spending a lot of time with you, and that time is going to be spent doing diagnosis. We don't want to jump into treatment right away. We want to diagnose. We want to look. We want to make sure that whatever you're going to do is well thought out, so that when you do decide to do it, it's going to last for a long time. Does that sound good to you? Yeah, that sounds good to me. And then I'd ask a simple question. Do you have any questions of me? Okay, now one question you might get is, how much does it cost? And you say, well, I really need a lot of data in order to be able to do that, and that's why we've made the examinations so reasonable, so that we can get all the data, and then excuse me, so for $79 or $50 charitable giving campaign, we'll be able to go through all that. You'll be in the office for about an hour, hour and a half, maybe even 2 hours, and by the time you're done, you'll have a complete picture as to what's going on in your mouth. I know some of you may want to delay that, do the data intake on the first visit, and then do the treatment plan on the second visit. That's fine. That's your choice. We found that for any patient that we can get the complete treatment plan done on the day of treatment, smiling, and the patient is ready to make a decision, we found that it's to our advantage and to the patient's advantage to do the treatment plan and have the patient schedule and pay at that time, and pay in advance. And that's the direction we're going to recommend you move to. Some of you are going to be ready. Some of you say, I have another system that works for me. That's perfectly fine. All I can tell you is what we do. And then you just say goodbye. And when the patient walks in and talks to the assistant, I guarantee you that at least half the patients are going to say, that's the first time the doctor has ever called me before the visit. It's worthwhile. I might say, oh, I don't have time to do that. Well, we all ride home. We all have cell phones, and we all have dictating machines. At least most of us do. And so we can make the phone call on the way home. And we can use our dictating machine, and we can dictate what the results of the phone call were. Because we want to have those notes. You want to have additional data, so that when you walk into the operatory, how you walk into the operatory now, and you've never met the patient, and so there's the handshake and the greeting, and then you get all of the data at that point. You know how much chair time that takes? Imagine going into that examination with a running start. Two of you have already talked. You've got notes on everything. And so now you've already met each other. It can reduce chair time by 10 minutes, 15 minutes, 20 minutes, so that you can get right to it because you already know what the data is. So everything's laid out in front of you. Your assistant has already talked with the patient, so additional things the assistant has that the patient has related to the assistant can relate to you. You've already got the data, you got the x-rays, everything's there, and photographs are marvelous. Imagine photographs that are projected on a 37-inch screen, which is what we have in each of our operatories. So patients can see their defects and really enlarged. It's fantastic. And so that when you walk in, the patient's already staring at his or her own mouth. You've already talked with them, and you can get going with data collection, probing, whatever it is that you're going to do in order to be able to come up with a treatment plan and reduce the chair time that's taken. So that's a big part of what we do. Now, once this data is collected, the next thing that we do, and I'm talking about once Jasmine has talked, or Jennifer has talked with the patient, then we send out the shock and awe package. Okay, what's the shock and awe package include? And I'll give you some of the things that we've done. And for some of you, you're going to say, wow, that looks like a lot. And all I want to tell you is do one thing at a time. If you don't have one article that you've written about what is important to you in dentistry, write that article. Get it typed up. Have it look neat and in some kind of fashion where it's duplicated and it looks like it's really duplicated well and it looks good, and just have that out in your reception room. That's how I put together this booklet that's called Isn't It Time for Solid Bite? And you can see, I don't know if you see my logo because I can't see myself right now. There it is. Okay. We created Solid Bite. Okay, that's the clear choice of Melbourne, Florida, if you will. Except we save teeth as well as extract teeth and put it in. So we created a booklet. That booklet's probably 18 pages, something like that. And I drew some pictures and things like that to make it look good. And of course, all of you know that I published the Ultimate Mouth Manual. All of you have that, and we've got the second edition. I hope you've received the second edition. I think we sent that out to you. It's blue. And, okay, how do you write a book? You write, remember I told you about the 500-word article? You just keep on writing more and more 500-word articles until you get enough 500-word articles that you can make a book. Okay? It took me 7 years to get the first book done. It took me a year and a half to get, or 2 years to get the second book done. So you can do that. But right now, we just want to have some good data. You go to a professional photographer and you have a nice picture taken of yourself and your staff. And you go to a great printer and you have a folder made which will include all of the things that we're talking about. Okay, you put in the medical and dental history so the patient can actually fill that out before the patient gets here. What separates us? Okay, what's different about your office? Write it up. Meet with your staff tomorrow. Say, what are all the things that separate us from everybody else? And you see how we did this? We published this on it, put this on a stationery. It's not a big deal. And put that in there. You know, if you're the only one with a CT scanner for 30 miles, you can say that. If I'm going to talk to you about ceramic implants, which I think are real important, and it does differentiate you. And people come in from hundreds of miles away for us to do Ceraroot implants. Yeah, that differentiates. Okay, you can write about the fact that you do a ceramic implant. Whatever it is that's different. You may have a certain way of treating perio. Some of you have a laser. Some of you have a perioscope. That differentiates you. And so put all of those things in so that people understand there is a reason to see you. You're not just like every other dentist or even every other periodontist around. That, in fact, you are a little bit different. And let people know that. And so that gets included in the folder. Okay? Welcome to our office. Okay? We have a professional videographer who came in and filmed us at work, and it took maybe 2 or 3 hours of his videoing, and then he made a nice little 5 or 7 minute introduction to our office. Probably cost me less than $1,000 to do once. And then we just duplicate that DVD and put a label on it, Put that in there. Let them see that you're a little bit different. Okay, those are the things we put into this into this package, and then put it in a priority mail envelope. Well, there's two reasons for that. Number one, patients love priority mail. They'll give it almost the same attention that they'll give a FedEx package. Number two, it's actually easier and cheaper, and you know how big the stamp should be, or how much the stamp should be on a priority mail envelope. So it's the envelope is already created. It has a little bit of an attraction for the patient, and in addition, makes it easier for you. So you create that shock and awe package. Again, you're differentiating yourself. Okay, you probably already have materials in your office that you can use. If not, start to create them and go small and then gradually go bigger. But do it. Start writing and start doing some of the things that we're recommending. Or you might have your own ideas to make yourself look a little bit better. This folder, yeah, we have professional photographer do that, and then we had a real top-flight printer do this folder. I think the folders came out at about $1 a piece. Oh, my wife's listening. She's probably going to say it was more than that. I can't find out what it was, but it's a good folder. You can see here's the folder from the outside. Here's the folder from the inside, and the inside we also have it printed. This is actually an area that's going to retain some of this paperwork, and so we want to get it printed inside and out. Make sure it looks good and makes it look first class. Looks first class. Patients are going to expect first class when they walk into the office. It is a position piece that is one of the things that can make a little difference. Is there anything else? Yeah, I already did that. I just forgot to show you the picture that I created for it. That's probably the last slide. I put that in there. Okay, so what to do on the phone call? Number one is to get in communication. Number two is to recount what's already been noted. So, as I said, whatever Jasmine or Jennifer has written down, we talk about that with the patient. Number three is to verify that with the patient, make sure it's true. Sometimes what may have been transcribed isn't exactly right, and we want to get that corrected. So we verify that, and just let the patient talk. Patient's so thrilled to have the doctor listening to her or to him on the phone. Not everybody, but a lot of people are just thrilled. So just acknowledge what they have to say. You know, if they say something about bad about another doctor, you don't agree with that, but you just say, I understand. You know, the women in the audience, the women who are in AAIP already know. They say, I understand a lot. We guys we don't say that much. But I understand at least all you're doing is acknowledging what the person says, so the person understands that they are being understood. And then ask the patient if he or she has any questions of you. And that's the entire story. So let me go to the screen, and let me see if I can find you. There you are. Okay. All right. I want to see, I'm going to test.
Muted.
You talk for a second. Let me see if I can hear you. Eleanor, you're talking? Okay. Yeah, what I wanted to do is to kind of do
Muted.
I won't even pretend that you're going to be a patient. I see Colin, you're raising your hand. Let me just see if I can hear you. Colin, just try. Yeah, just talk.
Hello, Rex, you can hear me?
I hear you now. Yes. Oh, that's fantastic. Good. All right, Colin, so you want to be, this is Colin Richmond, folks. If you don't know, Colin is going to change the face of orthodontics and periodontics, not in a different way, but we're going to incorporate it in the AIP, because Colin essentially is creating a way in which we can predict in advance how thin the anterior alveolus is prior to orthodontic therapy, so that rather than having to worry about free gingival grafts being done later on, and rather than the orthodontist being concerned as to how far the orthodontist can labely position the teeth, Colin has come up with an index to allow people to allow orthodontists to recognize the fact that there is an inadequate alveolus, and we can graft the patient prior to the orthodontics being done, so there's that much leeway to move the teeth, and there's far less likelihood of having recession afterwards. This goes along with the concept of Wilcodontics, which was introduced years and years ago, and Colin has taken it to a new level. He's going to be giving a significant presentation at the AAP meeting. I hope you'll be able to be there and hear him, because some of these indices are just bang up, and some of the work that has been done has been just fantastic. And from a practice building standpoint, he's getting on the order. Colin, what is it? 2 or 3 new patients a week?
Yeah. For ortho-perio-related stuff.
Wow.
Yeah.
Okay. Imagine. Yeah. For patients. And unless Colin had educated the orthodontist, they never would have referred them to him. So it's been quite an education effort on your part, I'm sure, right?
Yeah, it has been, Lee.
Yeah. Well, congratulations, and thanks for doing it.
Thank you.
And Colin has a chapter in my book, too, that talks about this.
That's correct.
All right. So, Colin, you want to pretend?
I'll be happy to.
Okay, good. So let's pretend that you are the new patient who has already called for an appointment, and now I'm calling you to just talk to you and introduce myself. Okay?
Okay.
Good. Ring, ring.
Hello.
Hi, Colin. This is Dr. Lee Sheldon. How are you doing?
I'm doing great. What a pleasant surprise.
Well, good. I'm glad you're able to come to the phone because I'm really concerned about the problem you're talking about. I understand that you've had some bridges that have been failing, and that's been a real concern of yours.
They have been, Doctor. They're just like 4 or 5 years old, and now I'm told that I've got to have them redone. There's cavities underneath them, and I'm not sure if they were done well in the first place. All
right, and I understand that. Of course, when we see you, we're going to be looking at that. Excuse me. Actually, I am going to look at the quality of bridge work, and I'll be able to tell you about that.
Great.
But, you know, part of this is it's a disease process. It's not something that we necessarily have to kill ourselves about. You know, we don't kill ourselves about or don't get upset with ourselves about arthritis. We don't necessarily have to get upset with dental disease. Sometimes that's just a norm for some of us. And we're going to do everything we can to help prevent you from having more disease. But really what we want to do is look and make sure that these teeth are absolutely predictable, that we're going to be able to use these teeth in the future, and you don't have to have work done and redone and redone.
Nobody's ever done that for me before.
Okay. Well, we hope you'll find us to be a little bit different.
Great. I'm looking forward to it.
Well, me too. Are there any concerns that you have?
Yes. Do you take my insurance?
You know, Jennifer's really good with insurance, and yes, we do work with insurance companies, and I'm going to have Jennifer call you. Have you already talked to her about that, or is this the first time you've asked the question?
Not yet. I will look forward to speaking with her.
All right, good, and we'll make sure that all the insurance questions are handled, and the answer is any insurance benefits that apply, we're going to make sure that we're going to get them to reduce the cost of your care, okay?
That'll be terrific.
That's good. Any other questions you have, Colin?
No, I'm looking forward to meeting you. I'm so impressed that you took the time to call me this evening before our visit.
Well, thanks. I appreciate it.
Nobody's ever done that before. Thank you.
Well, that's pretty neat. Thanks for saying that.
I also want to compliment your staff. They've been so terrific in setting me up an appointment and dealing with my complicated schedule.
Well, that's good. You know, I'm really happy to have the staff working with me too. If they're making your life easy, imagine what they're doing for me.
Indeed. That's great. Well, we'll see you soon at that next visit.
All right, great, Colin. Look forward to meeting you.
Take care, Doctor.
Thanks. Bye-bye.
Bye.
Okay, and that's the way the phone call goes. That's pretty much the way it is. So I'm happy to take questions. Now I know the sound is working. If there is a question, just raise your hand. Eleanor, I see you
unmuted.
Raised. Do you want to talk to me? Eleanor, you want to talk to me? No, I guess not. My wife doesn't want to talk to me.
Muted.
But anybody else who wants to talk? Colin, do you have another question? Because I see your hand raised. Colin?
No, I'm good. I'm good.
All right.
Thank you. By the way, I don't need any dental work. I'm in good shape.
Good to hear. All right, good. Any other questions, any other concerns? All right, good. Well, listen, I appreciate your joining me. I think Danielle is going to be with us next week, and we'll have a teleseminar. And foolish me, I forgot what the title is, but we'll get that out to you. In the meantime, listen, let's keep on working together. Get your practices going in the direction you want them to go in. You know, and I repeat, it took me a while to get here, so it doesn't have to take you as long as it took to get me. And I'm happy to share any of the information that you need, any special concerns. Please don't hesitate to let me know. Great talking with you as usual, and I'll talk to you again soon. Thanks.